Assalamu alaikum everyone and welcome to VR Duchess. Today we will demonstrate one of the final and most delicate steps of phaco surgery, cortical cleanup, using irrigation aspiration technique. This step actually begins much earlier when you create the side port with the MVR blade. The angle of your side port is critical because it determines how your irrigation and aspiration instrument should enter the eye. Always respect the original vertical angle of the side port and insert both instruments along with the same trajectory. Avoid entering too horizontal or too tangential, otherwise you will apply unnecessary pressure on the globe while trying to force the instrument through the incision. Many surgeons assume that the problem is that the side port is too small and try to enlarge it. However, in most cases, the issue is not the width of the incision, but the direction of the entry. Once inside the AC, cortical aspiration begins by engaging the cortical fibers. But instead of sliding the aspiration port sideways or swiping across the capsule, roll the aspiration handpiece gently between your fingers. This rolling movement catches more fibers and minimizes the stress on the capsular bag. After you have engaged the cortex, gently pull it out towards the center of the capsular bag before increasing vacuum to complete the aspiration. One of the most dangerous mistakes is tilting the aspiration port posteriorly or sideways, especially under the main incision. Even a slight posterior movement can engage the posterior capsule, resulting in a posterior capsular rupture. This is always caused because of the change of angle of the aspiration port. On contrast, you can see how the rolling can safely engage the fibers and take it out of the eye. Remember, after grasping the cortex, withdraw in the same plane in which you entered. Don't move deeper into the bag or angle the aspiration port posteriorly. This may result in rupture. Another common issue occurs unconsciously. As surgeons concentrate on the aspiration hand, they may pull the irrigation handpiece partially out of the eye, compromising the anterior chamber stability. A useful trick is to lock the irrigation handpiece immediately after entering the AC. Rest it gently against the side port so it remains stable while your other hand performs aspiration. This allows you to focus completely on cortical removal while maintaining a stable AC. Speaking of the AC stability, maintaining fluidics is essential for cortex aspiration. As in this case, when the iris went out, you can see how the AC become unstable and you can notice the corneal wound corrugation with every aspiration attempt. In this situation, vacuum become ineffective, making cortical removal more difficult and less safe. In contrast, with a well-maintained AC, aspiration becomes smooth, stable, and much more efficient. Finally, let's discuss hand stability. For right-handed surgeon, bimanual IA in the left eye can initially feel awkward. The left hand often floats without support, leading to unnecessary pressure on the globe. A simple but highly effective trick is to extend the little finger of your left hand and rest it gently on the patient's forehead. This creates a stable reference point, improving fine motor control while preventing excessive movement or pressure on the eye. As you can see here, the little finger remains anchored on the forehead, providing excellent stability, while the aspiration hand moves freely and precisely. Mastering these small technical details makes cortical cleanup safer, smoother, and significantly reduce the risk of PCR. Thanks for watching.